So look, without any further ado, I'm really pleased to introduce to you Dr. Nikki Jamieson, and I am going to read you her bio. Nikki, I know it's one of the more uncomfortable things in life to sit and listen to your own bio, but I hope it's not too awkward for you. But for those dialing in, I did just want you to get a sense of Nikki's work and what she brings to the table in this space because it is quite incredible. So Dr. Nikki Jamieson is a suicidologist, researcher, author and social worker, and holds both a master's and PhD in suicide in Australia. Nikki's thesis concerned moral injury and suicide. Nikki is considered a global expert on moral injury and suicide and has led innovative research on the topic, which you're about to hear about. She's also widely published, has authored 2 books, several papers, a micro-education app, which fascinates me. I look forward to hearing more about that at another point in time, Nikki, and is a keynote speaker nationally and internationally. And I first heard and met Nikki at the Frontline Mental Health Conference for first responders. Dr. Jamieson has also worked strategically within suicide prevention across a range of government departments, including the Department of Veterans Affairs, Queensland Health, Queensland Mental Health Commission, and Defence, and has been involved in a range of projects, including the development and implementation of Queensland's Suicide Prevention Plan and Defence and DVA's mental health and wellbeing strategies. Nikki has also been involved in the lived experience space for many years after losing her son to suicide while he was serving in the Army. Nikki remains actively engaged in suicide prevention with memberships nationally, internationally, and locally, including International Association for Suicide Prevention, Suicide Prevention Australia, Standby, and Postvention Australia, and the Australian Institute of Health and Welfare. She has advocated for better mental health, wellbeing, and suicide prevention for Defence members and veterans, including being instrumental in the Royal Commission for Defence and Veteran Suicide. So after a bio like that, one, I think you should hopefully be feeling excited that you're in for a treat. But 2, impressed by how much, Nikki, you have managed to squeeze in to your professional life so far. So we're in really good hands. We really appreciate you being with us. And I encourage you, as you're hearing Nikki, just to jot down some notes or questions that you might have. We're going to have about 10 minutes at the end for Q&A. So it's a real opportunity to contextualize what you've heard into your workplace. So Nikki, welcome. Over to you.
Thank you, Cameron, and thank you, Richard, for that lovely acknowledgement and welcome to country. I'm currently sat in the beautiful Shire of Noosa on Gubbi Gubbi lands, and happy for you to post where you're sitting, which land you're sitting on in the chats as well. I won't be able to see the chat as I present, so Cam, I'll be leaning on you to give me any questions or anything at the end as they pop up, but I'll share my screen now, so hopefully everything goes according to plan. I am a bit of a running joke in my office because anything IT that I touch tends to go to bleep quite quickly, so hopefully this won't be one of those days where that happens. So here goes. Let me just Okay, let me know that you can see that okay and hear me okay. Brilliant, perfect.
You can tell people back in your office that you completely nailed that. Seamless.
Maybe it's a bit of a facade so they don't give me the IT things to do. Okay, so without further ado, so just to acknowledge, I do work part-time for the Department of Defence currently, but the views that I'm presenting today and the research that I'm presenting today are strictly my own as a researcher in this space. They are not the views of the department or the Australian Defence Force. So we've already had the acknowledgements so far as paying respect to original inhabitants of all of the lands that we're situated on today. But I really want to acknowledge, excuse me, and thank those online today with a lived or living experience of suicide or mental health issues. I also meet that criteria, having lost my son to suicide, but also experiencing significant suicidal distress myself, have, accessed the mental health system through previous mental health episodes and suicide attempts, but I've also cared for a number of people who've experienced suicidal distress as well. And so I do bring a strong lived experience, and I'm really thankful and really grateful for you being here today. I do understand that talking about this topic can evoke some of those strong emotions. If you do happen to feel a bit activated or overwhelmed, please do reach out to the supports that you usually reach into and trust. Or you're more than happy for you to have a conversation with me as well, if you feel that will be useful or appropriate. So what are we going to talk about today? So we're going to look at what moral injury is. Now, some of you may already be familiar with what moral injury is, and hopefully this is a bit of a refresher or a bit of a recap. For those that are new to the area, hopefully you'll be able to take some, gold nuggets of information away with you today. We'll look at some of the symptoms and impact. We'll look at some of the impacts on children and families and moral injury, particularly in the workplace, but also look at some of those brief, strategies or approaches that you can start to think about, that you can take away, little nuggets of gold you can take away today to start thinking about in your workplace. Now, I come to this place having years of experience across different areas and not actually realizing that I was being exposed to these potentially morally injurious events. So what I mean by that is I actually started my career before social work. I did 2 years of nurse training. So I was a training nurse for a couple of years in the UK, working across a variety of different wards, in children, aged care mainly, but seeing some of the processes and ways people were treated back then, and I'm talking in the 90s, so probably showing my age a little bit then, didn't sit right with me. There was something not right and something I just couldn't articulate what was going on for me. It just didn't feel morally right, what I was seeing. So I actually moved into social work with the intention of trying to help and support children and families who were struggling with, behavioral concerns, developmental concerns, mental health concerns, and just giving, people a safe place to be able to share some of their concerns. I did end up doing a stint in child safety. Wasn't that an experience? Again, I was exposed to a few situations which I would consider now as being morally injurious, having to leave children in environments that were clearly unhealthy and clearly unsafe, but the policy at the time absolutely restrained me from doing anything about that at that time. So I was really confined in the system that I worked in, and that was creating significant moral distress for me. I then ended up in early years mental health, which I spent for about 12 years there, working clinically with pediatricians who would, tell me how they felt terrible because they were having to give children diagnoses just to get them support in the education system, and how that was against what they felt was their Hippocratic oath and was against their moral values. So all of these experiences really started to come together when I lost my son, and having a look at what defence and DVA do and what the research says more broadly about those impacts that we often consider to be PTSD, but runs much deeper than PTSD. And I'll talk a bit about some of those differences as well. Fundamentally, what we were experiencing and feeling was actually moral injury. So that's what we're going to talk about today. So usually, and Cam, you would recognize this from the Lead the Way, I would do this little scenario in person where I would ask you to think about yourself as the conductor. So you have a big juggernaut tram heading down the railway lines and it's out of control. You're the little conductor with the question mark next to them. You have a choice. You can either direct the train, the juggernaut, onto track A, knowing that it will kill one person, or you can direct the juggernaut onto track B, knowing that in doing so, you will actually kill 5 people. You only have those 2 choices. which one would you choose? Would it be to kill one person to save the 5, or to kill the 5 to save the 1? Now you can pop it in the chat if you like, whether you would do the 5 or the 1. I will kind of do a spoiler alert. Most people would choose track 1. So they would sacrifice one person to save 5. Very admirable. But what if I was to tell you that person was your child? Shifts things quite significantly. And that feeling that some of you may have just felt, that tightening in your throat, that lump in your tummy, that hit in the chest, is the moral framework that you hold starting to kick in to tell you something is not right. That is what we call a moral dilemma. What often happens is we're faced with moral dilemmas in our workplace, in our everyday organizational, organizational institution, or whatever you work in, or we can be faced with it in community. We're constantly faced with having to make moral decisions. Those decisions can then go on and lead to what we call moral distress. If that moral distress is left unacknowledged or unsupported or untreated, that is where we see moral injury happening. So it's a continuum, and I'll talk a little bit about the continuum as well. So fundamentally, moral injury is a trauma-related syndrome caused by physical, psychological, social, and spiritual impacts resulting from those grievous moral transgressions, those violations of your deeply held moral values and beliefs. It's that lasting psychological and spiritual damage. But for a moral injury to occur, that actually has to be a potentially morally injurious event. And that can look different for us all. So what might be morally injurious to me may not be morally injurious to you, and vice versa, which makes it quite complex to think about, particularly when we're looking at supports and treatments and ways to address it. So essentially, moral injury can occur through a perpetration, so doing something against your values. It can occur through failing to prevent something, so seeing something, witnessing something, being able to do something to stop wrongdoing. It can also be about, witnessing bullying or violence or something that is just not very good in the workplace that goes against your moral values. A big one is betrayal. So particularly organizational betrayal and trust violated by legitimate authority. That legitimate authority might be your boss, might be your workmate, might even be somebody that you know and love. So betrayal is a key contributing factor to a moral injury, particularly betrayal against our values and what we believe to be right or what we believe to be good or true. So moral injury, even though, it feels like it may have only just popped up in the literature, it actually goes way back to 12th century BC. So some of the theologians and philosophers started talking about moral pain and those, what's right and what's good and what's true many, 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 many eons ago. Shakespeare actually depicted moral injury in his Macbeth play. Later, Immanuel Kant, I'll spell that K-A-N-T because my accent often makes it sound like something it's not. So K-A-N-T. He was a big philosopher back in the 18th century who talked a lot about moral distress. It wasn't until World War I and World War II we actually started to think about the moral implications of war and the moral implications of service and how that impacted people. The term traumatic neuroses was born. We also started to think about terms such as shell shock, which some of you may have heard of, or soldier's heart. Moral injury really did develop, so far as a research context goes, in that veteran and military context, but has rapidly expanded now into a variety of different professions. So through the Vietnam War and in the 1980s, it was considered moral injury to be so important and so significant to be recognised, it was actually put in the DSM-3, which is the Diagnostic Statistical Manual. And for those of you who work with it, clinicians, therapists, it is the diagnostic Bible on how we make a diagnosis for people who present to us with what issues and whatever concerns they present to us with. We're now on the DSM-5, which has been revised. From then to now, there's been heaps of work spanning in the trauma space. The term moral trauma, which is mine, by the way, just saying, came out a few years ago. Moral injury was actually coined in the 1990s, but because of the work that I do in lived experience, I really wanted to ground the term into people's actual experiences. So I wrote a paper and did a concept analysis and a Delphi study on what veterans actually thought moral injury was and whether the term moral injury was correct for them. And what came from that is they actually felt the term moral trauma was more useful and aligned more with their experiences of moral injury. So you may hear me talk about moral trauma and moral injury interchangeably. So across our workplaces, moral injury can pretty much impact any one of us at any time because it all is dependent on our unique moral values and whatever it is that is happening that might violate those values. But often we see it in our military veteran populations and our first responders. We see it in our corrections, in our veterinary staff, particularly with euthanasia of animals. So it doesn't have to be human to human contact. It can be that human to animal relationship as well. Since COVID, we've seen an explosion of research in the healthcare space, and that includes social work, psychology, mental health clinicians, peer workforce. We've seen it with journalism, we've seen it with teachers, we've seen it with lawyers. There are not too many occupations and disciplines now that are left untouched by moral injury. It is one of those things that once you know about it, you kind of see it everywhere and the pennies start to drop in what the differences are between moral injury and PTSD. So often we'll come into an organisation and we have a general sense of that moral safety. We have policies and processes. If we're really lucky, we have a good boss who we can really feel has our back if we need them to. But for some of us, that's not the reality. We enter into our workplace with this sense of moral safety, and then something will happen, maybe a decision, maybe a change management piece, maybe a process or a direction that creates a little bit of moral discomfort. Like, I'm not too sure this is the right thing to do, but this is what we've been told to do, so we'll get on with it. Doesn't quite sit well for you. That can progress into a moral distress depending on your values, depending on what the event actually is, but that can start to really influence and manifest as some of those behaviours we start to see moving towards burnout and vicarious trauma, some of that withdrawal stuff and some of that feeling, this is just not right for me and I'm really uncomfortable with this. If that's left unaddressed, and that's left unresolved, that's where we start to see the manifestations of moral injury. And that's the stuff where we really do need to start thinking about that more comprehensive, holistic support. Moral injury does have a strong connection with suicide and suicidality. So it's really important to intervene as early as possible before mental health starts being significantly impacted. So a few of those workforces lived experience. For our police force, it was the use of weapons, particularly having to pull weapons out when there were instances of, people experiencing a psychosis and police having to use weapons. In our defence forces, it was around killing and harming or witnessing harm, particularly to civilians and children. For our fireys, the bushfires that occurred a few years ago had significant moral impact, particularly with regards to animals. Some of us would have seen some of those, devastating pictures of the koalas that were impacted by the bushfires some years ago. I interviewed some of the fireys from those bushfires, and it was not being able to help the animals or help their neighbours or their neighbours' property during that time that really stuck and had a moral injury for them. And our nurses and our paramedics, the COVID pandemic created significant moral injury. Who gets the PPEs? Who gets to take COVID home to their vulnerable family members? Who gets treated and who gets left in the hallway? All of these experiences were incredibly morally traumatic and morally injurious for our first responders. The helping professions were all in some kind of helping profession. Trauma is often embedded in our work. A lot of the reason why we come to this place is to help others. And that helping often includes being exposed to other people's trauma. We're involved in situations where people may feel like they've failed to prevent or witness something, and that could be in the workplace, it could be out there working, with families or the system, or policies and processes being used as a weapon against people, that unethical behavior in the workplace, or really suppressing what we believe is right because the structure or the organization doesn't support what we feel is right, or the financial demands. We may have had budget cuts to a really vulnerable population that we know benefit from the particular funding, and is now being cut. All of that can really create some of those morally distressing exposures that can increase the risk of moral injury. Having a poor culture at work, having a poor support culture particularly, and increased stigma can increase the risk of moral injury. And that accumulated moral stress, so there's little moral stresses that accumulate over time without any of the repair and supports around it, can really increase the risk of moral injury. And what we often find is it really is often those little moral stresses that build up over time. It's actually quite rare to have one big moral distress. Usually it's a number of them. Similar in the suicide and suicide prevention space, there is never one factor. There's often a range of distal and proximal factors that come together at a certain point in a person's life. So what might moral injury look like? So the core symptoms really do tend to focus on that deep sense of shame, that deep feeling of guilt, betrayal, that loss of trust, and just that general loss of purpose, that what's going on for me, that loss of meaning, really trying to, help reinforce what that meaning and purpose is really helpful, and to support people with moral injury. Unfortunately, those core symptoms often lead into what we call secondary symptoms, and that can range from depression and anxiety, which can lead to relationship issues, significant social problems. Noting distrust and trust issues is a core factor of moral injury. That can also increase the risk of anger and increase the risk of suicidality, hence the connection between moral injury and suicidality. Now, some of these symptoms are very similar and often overlap with PTSD, and I'll go through some of the differences very soon. But moral injury is also quite happily married to and in bed with things like burnout, vicarious trauma, secondary trauma, and compassion fatigue. In fact, the most contemporary research is now telling us that burnout is actually a symptom of moral injury. So when we think about burnout, we should also think about whether the larger moral injury components are happening as well. So there's been a number of theorists who've kind of thrown around, well, moral injury could be adjustment disorder, it could be PTSD. Why does it have to have its own name? These are all just, different sides of the same coin. Wrong. This has been completely thrown out of the water. Moral injury and adjustment disorder are conceptually different. They do have overlap. So, and this is where some of the confusion comes in, and particularly the challenges in that clinical space in trying to tease the two apart can become very challenging. Moral injury and vicarious trauma, again, there are overlaps, but they are very distinct from each other as well. So it really is getting our heads around what is moral injury compared to what are some of the other conditions. The big one is moral injury and PTSD. There's a lot of research on this now, really clearly distinguishing the difference between moral injury and PTSD. So moral injury is generally considered it's that relational, it's that existential threat to safety. It's about that distrust. It's about relationships and relationship breakdown. And I'm not just talking relationship breakdown with your loved one. I'm talking about relationship with yourself and your moral values and your meaning and purpose in life, which is where we see the increase of suicidality. It really is that disconnection across all relationships. Whereas PTSD is much more about that physical threat to life, that physical threat to safety. It often activates the sympathetic nervous system for those who are interested in the polyvagal and nervous system response. Whereas moral injury, because of its need to withdraw and pull away and really, remove ourselves from anything inclusive or any kind of relationship, it activates the parasympathetic nervous system, which really is about closing down and containing ourselves to get us back to a place of safety. What has been interesting more recently is moral injury has been linked to chronic pain, particularly with female veterans and particularly those who've experienced betrayal-based moral injury. So moral injury can be through perpetration, as you saw earlier, but it can also be caused through betrayal. So for women in particular, female veterans are more likely to experience chronic pain, particularly in their lower back, if they've experienced betrayal-based moral injury. And as women, we do tend to hold a lot of pain in our lower back, and particularly pain and loss around grief and loss and trauma tends to just kind of, hide away there in our lower back. So it's not just me who's saying all this just because I can. This has actually been proven now medically. So people with much, much bigger brains than I have done really comprehensive testing on the brain to distinguish the differences between moral injury and PTSD. And what was found is moral injury and PTSD actually activate completely different areas of the brain, which absolutely cements the fact that they are two completely different concepts, but do obviously have overlapping symptoms. So moral injury is much more activated in the prefrontal cortex, which is where that moral thinking and empathy occurs. PTSD, on the other hand, is actually more in the hippocampus and the amygdala, and that's where the fear-based, the fight, flight, freeze response is often activated. So some of you may or may not be aware, but there's been a lot of work that I've been involved in over the past few years in really having moral injury firmly established in the DSM. So I mentioned the DSM earlier. It's the Diagnostic Statistical Manual that clinicians often use to make a diagnosis. We're now on version 5. In the revised version, and we finally managed to have some identification of moral injury embedded in the DSM. Now, they've kind of termed it under moral problems, which I'm not super thrilled about, but I'm happy for it just to be in there. Whilst it's in there, I'm working on a full moral injury definition going in the DSM-6 when that's released, which the APA and the DSM can take years. So who knows? Watch this space. But basically, it is giving clinicians now a tool to be able to make a diagnosis of moral injury, which means we can actually start to work towards providing really good treatments and supports for people as well. So children, a lot of people have asked me, can children experience moral injury? Again, this is a question I'd usually throw out to the audience, but I can't see the chats, so I will answer it for you. Yes, children can experience moral injury. Karen May has just done a PhD, and part of her PhD actually had a look at some of those moral injury implications on children, as well as PTSD implications as well. So moral injury occurs in children when they are witnessing abuse, when they've experienced neglect or betrayal or community violence. It can be when children are removed from homes. They can often blame themselves for the family breakdown, which can increase moral injury for them. A child witnessing atrocities and struggling with why adults did nothing, or they feel like adults did nothing, can be incredibly morally injurious for them as well. Some of the emotional responses, and of course, this is age dependent as well and developmentally dependent, but it may manifest similar to adults, things like shame, guilt, that confusion, that anger, that sadness, that bitterness, as well. It can be those really distorted beliefs about I'm not a good person, I'm awful, I'm bad, or that adults just can't be trusted, so I'm going to do this on my own and I don't need anybody's help, leave me alone. It can be that withdrawal, hypervigilance and hyper people pleasing as well. Or it can be a general loss of trust in humanity and questioning of that goodness and purpose in their young lives as well. So basically, their moral development is disrupted by that exposure to adults' wrongdoing. And that can include things like parental substance abuse and family violence. So we do see that intergenerational impact of moral injury. And sadly, that also increases the risk of children also going on and experiencing things like substance abuse or family violence, etc. So we really do want to work in that early intervention and prevention space where we possibly can. There's a few responses there. You'll be getting a copy of this. I don't need to go into it too much. But the Indigenous healing practices are really, really powerful, and not just for children, but for adults as well. That storytelling and narrative is extremely beneficial both for adults and children. And we often use it in part of our treatment processes as well, both as a bookend before and after, when we're working with people who experience moral injury. So, moral injury in the workplace. So we've kind of already identified that moral injury can actually occur in the majority of our workplaces, because it really is dependent on our moral values, and some of those exposures, what's going on in that workplace for you as well. So the area we will be focusing on really is the professional, and that's where we see, increased compassion fatigue, increased disengagement, increases in burnout, increases in absenteeism, people just leaving, which costs the workforce, hundreds of thousands, if not millions of dollars every year, and that disinterest, that withdrawal, pulling away from projects or work tasks. People just literally just had enough. That's it. Something's not sitting right. Moral injury, or moral trauma, as I call it, really impacts us on a number of different levels: emotionally, psychologically, spiritually, socially, and behaviorally, which kind of adds to the challenge and complexity, because it is a really multidimensional concept that requires a multidimensional and a multi-level response, which is what I'll talk about. So I'm hoping that you're at least semi-familiar with the psychosocial landscape that we find ourselves in at the moment in as employees or as employers. So Safe Work Australia have a range of resources on what some of those psychosocial hazards and risks are. They're kind of on the screen for you now. Apart from fatigue, which is a weird one, I'm not too sure how fatigue fits in there, but most of the others, in fact, all of the others, can increase the risk of a moral injury happening. So I'm currently working on 2 papers to look at the links between moral injury and psychosocial hazard and risk in the workplace. And I've also developed an organisational framework which can help organisations in build and support the mitigation and potential prevention of moral injury where possible. So things like exposure to trauma, that can absolutely increase the risk of moral injury. Some of the lower and lesser known ones is things like lack of role clarity. If your role is unclear for you and you have certain beliefs and values around your role or certain expectations of what your role was, and suddenly all of that has gone out of the window and you're doing something you didn't sign up to do, that can be morally distressing. And for some, that can increase the risk of moral injury. Intrusive surveillance, having your organisation check all your emails, check all your text messages, check all your interactions and communications with people, in the name of safety. Well, that may be considered intrusive to you and maybe just too much, too overpowering, and, just doesn't feel morally safe anymore in that workplace. Bullying, sexual harassment, poor organisational justice, remembering that betrayal is the #1 contributing factor to a moral injury. So having that poor organisational justice and not really having a just culture, so a no blame culture, can significantly increase the risk of moral injury happening in the workplace. And of course, if there's poor support, that can also increase the risk. Because as I said earlier, we expect to go into a workplace with some sense of moral safety, some sense of support being available. And when that's not happened or happening, that can create that moral distress, which can increase the risk. So how does moral injury affect teams? Well, the classic symptoms and signs, I guess, are some of those emotional and behavioural shifts. As I mentioned earlier, that withdrawal and avoidance and difficulty engaging can be a really big clue for people to really start to have those conversations and try and support that person and understanding in what's happening for them. Declining performance, somebody who may have been, really good, really performing well, suddenly not doing so well anymore. Increased burnout, don't like the job anymore, just really down and negative about the job, just no satisfaction there, or a loss of confidence in decision making in their leaders. That can really increase those values being transgressed and violated, which of course can increase moral injury. Distrusting leadership, again, is a big one because that can also be a betrayal as well. So these are the big ones that have come out time and time and time again in the moral injury research around what contributes to a moral injury in the workplace. So happy for you to add some comments in the chat here. So when you think about your workplace or a workplace you have previously worked in, what do you think might contribute to a moral injury in your workplace? Now you've got a bit of a sense of what moral injury is. I'll leave you a couple of minutes and then I'll jump back into the presentation. Now I can't see it, so Cam, I'm happy for you to either jump in with a few or we can leave it to the end and chat then.
Yeah, I'll let you know what comes through on the chat, Nikki.
Okay, cool. I'll keep presenting and then we can jump in unless there's a few coming in. Are they coming in thick and fast?
Not that I can see right now.
That's okay. We'll keep going while people think about it. So now we know that this thing called moral injury is a thing and it exists in our workplace. What can we do about it? There are a number of things we can do. So as I mentioned before, moral injury is multidimensional. It is multifaceted. It's not a one and done. It requires a multi-level response. So our leaders, for instance, what might they be able to do in the workplace? Well, they can have a look at some of those supports around psychosocial risk and safety. They can start to think about those moral hazards in the workplace and start to identify them. When they do that, they can start to assess the risks of that moral hazard. Can this lead to a moral injury? The hazard itself in the work that I'm writing at the moment, so a bit of a spoiler alert here, the hazard itself is actually the potentially morally injurious event. The risk is the moral injury. So what are those hazards? What are those events? What might contribute to a moral injury in your workplace? Assess those risks. How can we control some of those risks? Is it about revisiting the policy? Is it about re-going through process, pulling a team of people with lived experience together to have a look at some of the processes, to co-design some of the, potential policies moving forward, to co-design some of those supports, to build a peer workforce, either internally or externally. And then, of course, we need to make sure that those controls or those mitigation strategies are actually working. So we keep revisiting those and adjusting if they're not working. For our leaders
Nikki,
sorry, yep, go for it.
sorry, I might just jump in because I've had some great examples come
Awesome.
through on the chat, and I think that's really helpful to begin to identify what can be done. Examples within people's workplaces: constant exposure to harmful content, disclosure from forensic clients about things that they have done, defunding of programs by government in response to change of government, misalignment of appeasing government rather than serving the people who are impacted, which you referenced earlier, scapegoating of staff members by leaders, ongoing power imbalances that aren't acknowledged, character assassinations, so some of that interpersonal incivility, and poor change management processes, lack of leadership support for staff. So a lot of the things that you've identified, but some nuance coming through there as well.
Absolutely. And a lot of those really closely align to the psychosocial risk categories as well. So you can really start to see the alignment between the psychosocial space and the moral injury space. And that's some of the work that focusing on at the moment as well. So there are things that we can do at that individual, that leadership, and that organizational level. Another, I guess, approach that leaders can take is using what I call the SLAM model, and this is my model. It really is about acknowledging that moral distress as well. So it's being able to have those safe conversations with people that you trust and with your leaders that you trust, and that's not always an easy thing to do. So sometimes we may need to go outside of the organization and have some of those conversations, or look to our peers as well. It's got to be without judgment. I can't reinforce and emphasize the importance of, acknowledging without judgment. So for a person to repair and recover from moral injury, it needs a validation of the experience, it needs an acknowledgement of the experience, and it needs that zero judgment and that feeling of empathy and compassion so people feel safe. Remembering back that moral injury goes hand in hand with distrust. So as therapists and clinicians, we are way behind the 8 ball when somebody presents with a moral injury. Often, certainly when I've practiced, it might take 1 or 2 sessions to build that trust with a client, to start building that rapport with a client. With somebody with moral injury, it can take much, much longer because they're already coming from, a long way back when it comes to trust. So we have to build that into our supports as well. So as I mentioned, validating shared values, having that, that almost just culture, for those that are familiar with just culture, that no blame, decreasing stigma culture. Listen without asking, without rushing, and don't automatically jump in as if you're the savior and healer for this person. It takes time. Repair takes time. We can do this, slowly with people, depending on what their morally injurious event was. And taking responsibility, if leadership fails, acknowledge it. Transparency and accountability and acknowledgement is key to being able to support yourself and your staff, and being able to, fundamentally build trust in your team, your organization, whatever it is, your workplace that you're working in. So support your member, support your employees, support yourself. Listen intentionally, really tune in to what the person is saying. Ask questions. What does that mean for you? And model good ethical behavior wherever you can. Model transparency, model accountability, model that you're taking responsibility. So that's the SLAM model in a nutshell. But some of the chat comments you mentioned about those, over the exposures of events, things like that, there are some things that we can do as an individual as well. It's not just about organization blaming, it's not just about leadership blaming. We are empowered to be able to do things for ourselves as well. And what that might look like is preparing. So if we know we are going to be exposed to a whole heap of traumatic material, try and minimize where possible. Only read, view, or listen to what you have to do for your role, and really connect with, your trusted supports, your supervisor, your colleagues, or whoever you can confidentially talk to, because some of this would be super sensitive. And wherever possible, don't take your material home with you. Try and have that boundary. This is work, this is home. Know the signs of moral injury. Know what it's feeling like for you. For me, it's that feeling in my stomach. It's that feeling in the chest. Something is not right. I start to tighten up and things just start to, compress inside me, and it just doesn't feel right. Trust your instincts. If something doesn't feel right, there's usually a reason for that. Have a think about what that means for you, and take a bit of time out if you can to reconnect. It might be socially, with your supports, with your family, even taking your dog for a walk. I've got 4 dogs on my property. They are my absolute lifesaver. So if I'm feeling a little bit heightened or activated, I'll go out and I'll take my tripod dog into the yard for an hour, or the pool for an hour. So clarify what material is necessary, reduce that sensory detail, and build routine self-care in. So it's about planning where possible, knowing your signs, and building your own strategy around that. And try and avoid some of those unhelpful coping. And, I'm guilty of finishing work and, polishing off a couple of glasses of wine after a really heavy day, or a G&T. Not always helpful, but yeah, limitations, boundaries, try and be sensible, and try not to, enhance some of those unhelpful coping strategies. This is just summing up the workplace and moral injury in summary. So Mark Layson tells us that work behaviour that contradicts one's moral beliefs can lead to psychological, social, or economic problems, and that does include burnout, compassion fatigue, and/or moral injury. So he talks about, as I've mentioned, identifying some of those hazards, some of those psychosocial hazards, which you've mentioned in the chat and which I've mentioned as well. Identify. It doesn't have to be a big thing that we do. We can just use little discrete anonymous surveys. We can observe what's happening in the workplace. And somebody mentioned scapegoating earlier, and using the resources that we have in the workplace. We have, things like EAP, or we have external supports. We can act, we can identify the risk, we can report, we can visit the legislation and the policy and guidelines, and use those as tools to help us to help change the system, as well as, seeking your own mental health support. I find what needs to happen, particularly in a defence context, is there does need to be much more focus and training on building compassion and emotional intelligence. I have to say, in the healthcare space and in the helping profession space, it's not as often I see those challenges, but they're in certain professions, particularly those that are quasi-military and military. Some of that emotional intelligence awareness tends to drop off, and that can be really important to support people in reducing the risk of moral injury. So the good news is there are now lots of assessment tools and approaches. So for those that are interested, these are some of the validated tools and approaches that you can use if you are a therapist. I won't spend too much time. We've already said that. We've already talked about. This was the lived experience process of transforming their morally injurious experience. So what they were telling me and continue to tell me, it really is about that acknowledgement and validation. It's about reclaiming their experience, reframing it to give them something that gives them more purpose, and then repurposing it. If we think about that pragmatically, I'm a walking, talking version of this process. I've taken what happened to my son and the experiences I had prior to him dying, and I've reframed it hopefully into something and repurposed it into something that I'm hoping you're getting value from today. Post-traumatic growth is very, very possible given the right supports, obviously capabilities and motivation. Unfortunately, what I also see, particularly in our lovely helping profession space, is we're not very good at self-care and we're not very good at caring for ourselves. We put a lot of focus on helping others, but we made it this far on our own. We'll keep doing it. I come from a Northern England, a Yorkshire culture, which is very stoic. You get the job done, you pick yourself up, you dust yourself off, and you just get on with it. You don't bother with all this self-care rubbish, you just get on with the job. So for me, very much so, I made it this far on my own. So what? That hasn't been healthy for me, and it certainly hasn't worked. As I've told you earlier, I do have a lived experience, and probably had I sought support earlier and not had this bullish stubbornness, I may have been able to reduce some of that. But this happens a lot in the helping professions. We just want to help others and we often forget ourselves. But we may not feel it is a problem. It may be others who see it as a problem and can actually help us to see what we might need to do or address. Our families and our loved ones are a brilliant barometer to test whether we are actually experiencing moral distress, burnout, or moral injury. They can often see the changes before we recognize them. So they are a great barometer. So it's good to, check in with them at the moment. Is there anything you're noticing about me that, is a little bit off for you? Or is there anything that, is happening that you're a bit curious about? So seeking assistance is often seen as a weakness. This was specifically prevalent in the veterans and defence and police contexts. Isolation is the normal practice of the struggling helper. I certainly saw this in social work and child safety. It was just kind of, this is your job, let's just get on with it. You can have supervision, but how many of us actually have time to get deep down in the nitty-gritty in what's going on for us in supervision? Often it was about the job or the client or what you need to do. And for me personally, you may have had different experiences, but often I didn't get time to go into the nitty-gritty of what was actually happening unless I was activated and things were exploding. So the fear of stigmatism, fear, of losing your license. What happens if I present with a mental health concern and I'm a defense member and I have a firearm? That means I'm not going to be able to do weapons training. It means I'm not going to be able to deploy. It has significant impacts on my job. Lack of time. I have no money. To see a psychologist nowadays is around $250, and then you'll get a little bit back on Medicare. Some people don't have the time or the money for that. And some people have just never done it before. So there's that unknown. Oh my goodness, what does this mean? Are they going to strap me in a chair and I'm not going to be able to move? So there's lots of things that stop people seeking support. And I guess part of our role is to try and help break down some of those barriers and enhance some of those learning and understanding. So as I said, it takes a multi-level response to address moral injury in the workplace. It takes the individual level response. It's about understanding your own moral activations and being able to act on them. It's about clarifying your own values. It's about seeking support early, really is about, that engagement of your supports, including your family. It's doing what you're doing now, educating yourself on what moral injury is so you can have those conversations with other people. It gives you a language to speak to people about. Building those peer support networks as well is really, really beneficial in this space. Organizational level, we can certainly influence where possible. So building our leadership, again, it's not about leader blaming or manager blaming. It's building and acknowledging their roles. It's building their education, recognizing some of their knowledge gaps and helping educate and build their understanding. And hopefully they're open to that and, act on that as well. It's about being informed, being included in policy and strategy development where possible, building that lived experience network and co-design, having clear guidance, clear job roles, doing that psychosocial risk mitigation. So really supporting some of those psychosocial hazards. So once you've done your own workplace psychosocial hazard, assessment. For social and community, again, it really is about, building that awareness. There's still many people out there who've never heard of moral injury. There's still many people out there who are being treated with PTSD, but unfortunately are not seeing any benefits from treatment and are often getting worse. And that is often because for a long time, PTSD was the go-to clinical diagnoses. Unfortunately, some of the treatment responses for PTSD actually do a lot of harm for people who have moral injury. So in the community, it's about advocating, educating, seeking funding to do research or, building community supports. It's about reforming policy where we possibly can. That's in our circle of control. So what can you start on today then? So there are some little things that you can start to think about. Could be basic questionnaires. Like I said, we used to have, those little kind of anonymous quiz boxes or feedback boxes, and people would just anonymously slip in notes and paper. If we could change something in this organization today that would improve the moral culture or the moral temperature, what would it be? And then people potentially put in the suggestions. Identifying those moral hazards is fundamental, because if we don't know what's there and what's not there, we can't address it. Start thinking about risk mitigation. What might that look like for your team, your organization, and providing that moral injury education like what you're doing today, and creating those networks. Some of those much, much longer changes are really around that cultural change. It's about promoting open mental health discussions, which often I find in the health profession space and the helping profession space, that's usually kind of a given, and it happens, relatively frequently. Getting the good ones can always be a challenge, but it happens frequently. Increasing that transparency and accountability is really, really important. Again, having that just culture, no blame type cultural responses is really important, and making sure that access to support is clear and people know where to go, when to go, and are allowed to go as well. So many times we've provided little fact sheets of supports, but people don't have the time, the capacity, or the money to be able to go. How can we help support people as and when they need it? And of course, encourage self-care. And I always feel a little bit hypocritical about that last one, because I'm terrible, absolutely terrible at self-care. I am great at preaching it and totally acknowledge the importance, but I'm terrible. So who can provide support? Well, you. you can have those conversations. You can start to open those discussions. For those people who need much more support, there's a list of supports and resources there that I'm sure you're all familiar with, but your peers and your managers can also help. Building an organizational framework is the work that I'm doing at the moment, and I'll be hopefully publishing a bit later this year. But it really is fundamentally, it's about moral injury reduction and prevention, acknowledging that we're not robots. To have a moral framework means we're actually human. So not all moral injuries are going to be preventable, because to be preventable, we would all have to turn into robots and not have any values whatsoever. So we really do want to look at how can we reduce some of those morally injurious events so it doesn't lead to a moral injury wherever possible. It's about using evidence and best practice, building the workforce and building in those supports and recovery opportunities for people as well. What are the next steps? Need lots more research. So if anybody is interested in doing research, hit me up. Always happy to collaborate. Data collection. We don't really collect too much data on moral injury in this country. There's been a few different pieces of research, and it varies from between 30% of people who identify and meet the criteria for PTSD all the way up to 90% also meet the criteria for moral injury, depending on the research, depending on the sample, and depending on how many scales, how many items, sorry, of the scale moral injury in the moral injury scale that was used. So very, very early days with the research, but basically it was saying that when people present with PTSD, there's a good significant cohort that would also meet the criteria for moral injury, but that side of it is not getting treated. And of course, training and education, all using lived experience to help us understand and recognise those differences, but also the lived experience and how we can use that to support, future developments. So key take-home messages. Moral injury can impact anyone, including children. Moral injury, PTSD, vicarious trauma, burnout are not the same, but can be comorbid, can quite happily be in bed together on any occasion. And moral injury does increase the risk of suicidality. Risk mitigation and responses do require that multi-level systems-based approach. And for the social workers in the room, this is our bread and butter. We live and breathe the systems-based approach to supporting our clients. So this is definitely not new. And more broadly in the suicide space and more broadly in the health space, we're moving more towards that systems-based approach. More research, more evaluation, and the need for a much more multi-level approach, as we've already spoken about. They're all the references if anybody's interested. And Cameron, you mentioned my little app earlier. That's the QR code for my micro app. The platform I'm using has just undergone a bit of a change, so hopefully there's not too many problems. But if anybody wants any more information, I'm happy to send that information out. But I guess over to you for any questions.
Thank you so much, Nikki. I think this is the third time I've had the privilege of hearing you present, and I just learn something every single time. And I'm sure you have hearing this for the first time. I do want to create some space. We've gone a little bit over, but if one or two people have questions, I'd love you to be able to engage with Nikki while we've got her in the room. Just unmute yourself, be brave, and I'm sure someone else will learn from your question.
Thank you. Sorry, that was me running over a little bit of time. I do tend to chitter chatter.
That's okay. I'm very happy for you to run over. Maybe you can pop it in the chat as well if you're not in the mood for unmuting your mic.
Nikki, it's Richard here. First of all, thanks. I missed you at the conference, so I'm so pleased I had a chance to catch up on that. And thanks for sharing your personal story as well as on top of all the professional knowledge you've got. If there's people here that are in an organisation that this is kind of just not even on the radar, and I know you've given us some practical things like what can we do straight away, But where do you reckon that if there's going to be one start point where that conversation sort of might unlock more than others, from your experience? What would be something if it's just in an organisation that's not even slightly on the radar?
I think for me, the first question would be, do you know what moral injury is?
Yeah.
So just having that conversation about people's understanding, because often that goes on to create a platform for a lot more questions. And if you have an experience that you feel okay to share, so this happened, and I'm wondering if this was, moral distress or moral injury. Have you ever heard of that? And then you can go into a conversation. And that's really about that education piece and sharing knowledge and advocating, because the more we know about it, the more we can learn and the more we can actually support people, our leaders and organizations, in being able to address and mitigate wherever possible.
I'm going to be cheeky and just tag on another quick short question.
Yeah,
Are there any, because I didn't get onto your QR code it gave me, instead didn't like it anyway, but in terms of some of those surveying tools or captures across an organization to check in, prior knowledge or just where capabilities at, is there stuff that we can tap into?
Do you mean like the assessment scales for moral injury itself?
Yeah, something like that, but kind of at a real entry level, for a starting team or organization.
So so we're not talking therapeutically, we're talking to do a bit of a
No,
temperature check in the
yeah,
organization.
exactly. Yeah, that start point.
Yeah, I mean, there are. The only, I guess, downside of that is if somebody is activated and there's no supports there to
Yep,
capture them in the first place,
yep.
that might be a problem. But it might be useful having a bit of a forum or in your team meetings. And again, asking, has anybody heard of moral injury, or having one of those, boxes, feedback boxes. We're looking at ways to improve the culture. What might be some of those ideas? Or is there anything in the organization that people are finding challenging right now, and pop that in there as well, maybe with a list of supports near the box.
Thanks, Nikki.
Lovely. Just two quick things, Nikki. A lovely comment from Matilda that worth jumping in and just having a look at that in the chat before you leave. And probably just the last one that we've got time for right now is, with the increase of working from home and the ability to separate, I'm sure we can all relate to this, becoming more difficult. What would you suggest in terms of, I'm assuming that's around sort of boundarying our work?
So what was that? Sorry, it just sound cut out a little bit then.
Yeah, sorry. So the question is, with the increase of working from home, the ability to separate has become more difficult. What would you suggest?
Oh, with working from home, well, I work from home the majority of the time as well. So we really do have to be proactive. So we really do have to do much more reaching than we would normally do in a team environment. So I call it those spin the chairs, where you'd be, in your open plan office and you'd spin the chair to have a conversation with people. We have to intentionally have those spin the chair conversations. So, either doing it as an intentional regular meeting every day. So we used to have daily morning stand-ups, literally for just 20 minutes in the morning, where we just check in with each other. How's everybody going? What have we got on for the day? Is there anything that you need a hand with? And then reaching into those colleagues, throughout the day, in your lunch break, like you would normally do in a normal office environment, where you can, and where possible and where funding allows. It's really useful to try and get everybody together at least once a year. It's certainly not possible where I am at the moment, because we've got 89,000 people in our organisation. But yeah, just trying to get together as much as you can. So yeah, hope that answers that question.
Yeah, thank you, Nikki. What we'll do, we will send those QR codes out to participants. I know that slide did disappear quite quickly, so you can get in touch and look at those resources as well. I'm incredibly grateful, Nikki, for you talk about repurposing, and you have found purpose that is so enormously helpful. There's obviously incredible integration into the sanctuary model, which is trying to build those environments where you can have conversations to prevent moral injury in the first place. So hence why we wanted to bring you into this context. And if anyone's joining us from outside the network, feel free to reach out and get in touch. We've got a conference coming up September 2 and 3, Lead the Way, where incredible people like Nikki will be big platform to support you in your sector. So I encourage you to jump online and have a look at that. But this is kind of our off-ramp for organisations, folks who have dialed in, and those sanctuary organisations are going to stick around for a quick 15-minute touch base. But I know there's a lot of appreciation coming through on the chat, Nikki, for what you've presented today. Feels like a privilege, a gift to us individually and our organisations as well. So a big thank you. And to those who are peeling off, thanks so much for joining us.
Thank you. Thank you, everybody.
Thanks, Nikki. See you later.
Oh, many people sticking around.
G'day, Steph. And then there was 4.